How's it going, guys? This is Mike. What I got for you today is my Bugout bag basic first aid kit. Uh, Basically, I keep this on the outside of my pack so you can get to it quickly. It hooks through my molly webbing, and this pulls up. You get it and gives you a shoulder strap in case you got to go a distance and run back to where the problem is. Starting back here. Oh, real quick, I'm sorry about the fruity color. This is a camera case. It was a bright neon blue, light blue, and I tried to dye it black. The nylon wasn't going to have any part of that though, so ended up with some zippers I could really do without, but it is what it is. That's what I got. Up in the top right here I have a roll of gauze. And this right here is my basic kit. This is for minor sprains, strains, lacerations, stuff of that nature. Minor bleeding, those kind of things. I do have a trauma kit for, sutures or major bleeding, deep wounds, things like that nature. I wouldn't say surgery, but you know what I'm saying. And so basically, when you're in your bug out situation, I'm looking at more than 3 days. I'm looking at bugging out. But needless to, that point is moot when it comes to an injury. Somebody could get hurt at any time. So, but I'm thinking along the lines of not being able to get to the hospital. I have to take care of that person. So I'm saying I would probably do a little something I normally wouldn't do, like put super glue in a wound, a laceration instead of stitches, taking them in for stitches, that kind of thing. Okay. Basically, what I got in here. This is my little clean up and pill station. But I have anti-diarrheal medication. You might really need that in the wild. Eating some funky stuff, you know what I mean? So anti-diarrheal. I got Benadryl. So that might be your only line of defense for somebody that has an allergic reaction, especially if you're way out there bugging out. You can't get them to an EpiPen or anything. I would love to have an EpiPen, but I don't have one of those. But I also got electrolyte tablets. That's basically what you get with Gatorade. So you get those electrolytes back in your system. You basically would need that for dehydration, heat stroke, someone that's in shock, those kind of situations. You might want to get them some of those, especially if they've been working hard or humping it. So you might want to do that. Definitely get them some water. Have some alcohol wipes, and I have some hand towelettes for cleaning your hands off, getting in your nails and stuff. I got another roll of gauze, just in a different container. I have a assortment of 4x4 gauze. I don't worry about the 3x3s. You just go for the 4s. If you got to cut it down, so be it. Whatever. That's for blood, obviously, or just keeping a wound clean. And then I got your normal assortment of all kinds of items here. I got knuckle band-aids, fingertip band-aids, band-aids, some steri strips for closing a wound. More of those things. There's a couple steri strips right there, but some of those for minor cuts, nicks. Save this for a minute. I got a little first aid do's and don'ts. It's pretty nice. Nice to have a little backup in case you're not sure on something. I have personally taken, I don't know, at least 8 years of first aid training, CPR, AED, a couple of splints for fingers, toes. That's basically it for the back portion. The front section, I got a headlamp. You know, it might be night. Ain't gonna do it by the candlelight. You know, by the fire, much nicer to be able to pop that on. And even during the day, if you got to look down into something and see if there's splinters or dirt in something, you can get down in there and work. And your hands free. Couple more things I have here. Okay, this is the real one. These two are just containers. They have my Tylenol and my ibuprofen in them. You know, your Tylenol's for pain, obviously, headaches, pain, and then your ibuprofen's anti-inflammatory. Get rid of some of the inflammation around whatever you have going, even if it's an ankle sprain. You want to get rid of some of that inflammation. That'll take a lot of the pain away in itself, and it does have some pain qualities there. Better safe than sorry. I got some triple antibiotic ointment with pain relief. A little bit of both in there. A goodly amount for a little kit. But it's better to put this on now than have an infection set in. Just put it on there. Got my Mylar blanket. You know, all the uses for a Mylar blanket other than first aid. But in first aid, you know, it can help somebody with that's in shock. Somebody that has a strain, it just kind of makes them comfortable while you're working on them. I got a set of gloves in here. You're going to run out soon, but you got at least one set of gloves. My trauma kit does have a couple more sets of gloves where you're really going to need them and you don't want somebody to get an infection. I have a quick clot here, styptic pad basically. It's going to stop the bleeding. You can use that on anything. And it's big enough to use even in my trauma kit. I do have another one in my trauma kit. Hand sanitizer. You know, you want to get your hands clean before you start working on somebody, especially if you're out of gloves. You want to make sure your hands are clean. Use your the pad, the wipes that I have in there, the small wipes. Those are for cleaning out your nails and stuff, because this isn't going to do it. But just kind of clean yourself up a little bit. You don't want somebody to get a bad situation worse, basically. This is for splinter removal, obviously. Something in the eye. Removing foreign objects from a laceration, a deep wound. A little trick I'll tell you about, you probably already know it. Uh, this is, this is my iodine tablets, and I actually have chlorine tablets in there with them to make it taste better, neutralizer. But if you take the chlorine tablets, you can take and add a small amount of water to it, make a paste, and you can use that to treat a wound, to prevent infection. So that's a nice little thing you can do with that, other than just making good water. Plus, if you have that here, if you have to take your pills or anything, get some water for that person, you do have something to sterilize it. I would say if you're going to use brackish water, or even running water that's water that you don't know is clean, even if you do make that paste to put on a wound, you're going to have to wait 15 minutes for it to do its work. You don't want to add any bacteria in there, that's for sure. So that's in there for that purpose. Super glue, crazy glue, for wound closure. I have actually used this on a person's wound. They should have went to the hospital probably and got some sutures, get some stitches, but we had to do what we had to do at the time. We had some super glue. We put it in there, and to be honest, it wasn't even. We hadn't even put enough pressure on it to stop the bleeding well, and we put this on there because it was bleeding profusely, and closed it up, even with the running blood, and it closed that wound, and it stopped bleeding. And later on, he didn't even have a scar from it, and he had a nice little, 1.5 inch deep gash from a blade. So this does work. It really does. Here's a lighter for sterilizing your tweezers or whatever you got going. If you had to boil some water, you could do that. If you had the equipment, the pot or anything. But it's good to have the lighter there. And now we're going to talk about styptics. Sometimes you get a wound, especially on the forehead, around the eyebrows, even your face. Knuckles are notorious. Just different spots that just don't want to stop bleeding no matter what you do. Well, a styptic will take care of that. This right here is a styptic pin. Most men know what this is. If you've ever, did some shaving with a blade, you nick yourself, it don't want to stop bleeding. You put this on there and it clots up like right now. That's just what it does. But that's a styptic pin for that reason. You want to stop that blood flow before you start putting the bandages on. You want to know that it's taken care of. Also, I got a wound seal, which is a powder styptic. I haven't actually used this brand or even used the powder seal, but I saw it and I thought I should add that to the kit. It doesn't take up much room. And then one other quick thing I'll say is, in my Bugout bag, I'm a big hot foods eater. I like hot food. I also like to mask the taste of some of the stuff that you're going to eat out there, especially if you start dealing with wild edibles. You start eating roots and greens, especially if you don't give them a second change of water. Some of them are rather harsh, but if you can add some cayenne pepper to that, you can kind of stomach it. And actually, cayenne pepper, that's one of the things it does is it helps your stomach. so you don't have an upset stomach. Uh, Kind of seems a little counterintuitive because it's hot. You would think you would get, you know, something. But the other things that I'm just a quick thing on cayenne pepper. Uh, one reason why I keep it is just for the taste myself. But it's a lot easier than bringing hot sauce. You can make it go a long way this way by having the powder. But also, the couple other things that cayenne pepper does for you is the capsaicin that's in it. That is the active ingredient. That's what makes it hot. That stimulates the brain to release endorphins. That's the body's feel-good hormones. You know what I mean? That's why people take drugs. I'm not saying it's good as a drug, but maybe to me. But it's also an anti-irritant when rubbed on sprains, strains, and joint pains. Think icy hot, but without the icy. But I guess basically, if you have, let's say you had ankle pain, you would make a paste out of it, and you would rub that on your on that area. Well, now it's going to get hot, and now you're going to feel the heat. The same thing as a hot pad, a heating pad, anything like that. You just basically it's a counter irritant. Okay. And then the other thing is it's a immune system stimulant. It helps stimulate your immune system. So if you start to get sick, it's good that you eat hot sauce. It's good. That's a good thing. But anyway, the reason why I brought that up at this point is because we were talking about styptics. Cayenne pepper is a powdered styptic. You can pour that right into a wound, just like you would this wound seal right here. And it's going to, or just like you would yarrow, what it's going to do is it's going to start clotting, and it's going to help that clot. So basically, that's where I was going with it. Long story short, I guess. But then lastly, but the only thing is with the cayenne, it is going to get hot. But if your alcohol wipe that you wipe on it is going to be it's going to burn for a minute too. So pick your poison. And then lastly, it's got a couple lancets. They're just basically splinter outs. They're a picture of the smaller one here, but it's basically an aggressive flat needle used to dig at the skin to get down to the splinter and pop it out of there. We all like to be macho and just pull out your buck knife, but you're doing yourself trauma. You're doing harm. So and we all know how shitty you can feel if you have a splinter. So that's why these are in here. Nice, quick way to take care of a splinter, especially if you get a couple in your feet and you got to walk. You don't want a bunch of pussy toes going on. But that's it. Like I said, I do have a trauma kit, and I'll do a video on that. One other, item that I do keep with me, for obviously other than bandanas, but that I keep with me for that most people might not. But I have an ankle support. I keep that with me. I don't currently have an ankle problem, but I have a bum ankle, and I know that at any point I could, roll it wrong, going down a steep embankment or something, and you can't be laid up. When you're trying to survive, I mean, you're just going to starve to death. You got to get out there and do what you got to do. So I keep that with me, which, like I said, most people probably wouldn't have that, but it might be a good idea. Mechanical injuries do happen. Okay, that's it.